I want to thank Ontarians for their ongoing resilience and commitment to community as we navigate the global pandemic together. Your sacrifices and collective actions will continue to make a difference as we navigate what is now the 7th COVID-19 pandemic wave driven by BA.5 Omicron subvariant. This variant has been increasing in prevalence since early June and is now the dominant strain in Ontario. BA.5 is more transmissible, which is reflected in the data we have seen in the last few weeks, including an increase in the provincial wastewater signal, as well as increases in the percent positivity, COVID-related hospitalizations, and ICU admissions. While we've entered a new wave, Ontario is experiencing a slower trajectory in this wave as compared to previous waves, and we expect to see the peak of this activity in the next 2 weeks. Our ability to keep this wave in check is in large part to the high vaccination rates and the availability of effective treatments and therapeutics such as Paxlovid and Evusheld. Though this wave is expected to be less severe, there are actions we can continue to take to minimize the impact on our health system, protect ourselves, our loved ones, and our friends. The most important message, which we've said consistently, is to stay up to date with your COVID vaccinations. Millions of Ontarians have not received all their recommended vaccinations. 5 million Ontarians have yet to receive their first booster, and over 1.6 million Ontarians at the highest risk for severe outcomes have not received their second. These individuals are strongly encouraged to do so as soon as possible to protect themselves from severe illness and hospitalization, especially for those that are over 60 years of age. While my call for arms remains the loudest for the most vulnerable in our communities, we've made the decision to expand the eligibility for second boosters to include Ontarians aged from 18 to 59 years of age. Beginning July 14th, individuals in this age group may choose to get a second booster if it has been 5 months since receiving the previous booster dose and at least 3 months after any COVID-19 infection. While we're making this option available, it is important to note that healthy, currently vaccinated individuals continue to have significant persistent protection against severe disease even 6 months after the last dose. However, there may be individuals with personal or medical circumstances in those age groups who may benefit from an additional protection of a second booster. Ontarians, if they have questions, may speak to their healthcare provider about whether getting a second booster dose is right for them. Additionally, if you are at increased risk for severe illness, have a plan for accessing PCR testing and treatment if you develop symptoms. Our community access centers remain open. The antiviral treatments, remdesivir and Paxlovid, are effective tools for helping to protect Ontarians and to reduce hospitalization and safeguard our healthcare system. Those with most severely compromised immune systems also have access to Evusheld, which provides safe, effective, and long-lasting protection in many instances greater than 6 months. So if you're at high risk for severe illness, I encourage you to speak with your healthcare provider to learn about the treatment options and have a plan in play. We want all Ontarians to have a safe and enjoyable summer, and in addition to staying up to date with vaccines and knowing your treatment options, there are other actions everyone can take to keep yourself and the community safe. When making plans for your summer, take the opportunity to gather with friends and family outdoors. It's also important to stay home if you are sick, even if you have mild symptoms. Practicing regular hand hygiene, cough etiquette, and will help continue to control the spread of this virus. And while masking requirements are no longer mandatory in most settings, Ontarians should continue to consider wearing a mask in indoor crowded spaces if they feel it's right for them, particularly if they're spending time with older and more vulnerable Ontarians. For those who are at increased risk of severe illness from COVID-19, particularly those who have not received all their appropriate doses of the vaccine, it is strongly recommended that you continue to wear a mask in indoor public spaces. In spaces where you may encounter people who are especially vulnerable, such as hospitals and long-term care facilities, you should continue to expect to wear a mask as the standard of care in those settings. To further support efforts to manage COVID-19, we will be continuing the broad distribution of free, rapid antigen tests in Ontario. You will still find free tests in places such as grocery stores, pharmacies, as well as workplaces, schools, hospitals, retirement homes, and long-term care facilities. This will be continued and reassessed by the end of the year. As I mentioned, Ontario now is in the 7th wave, but we have the tools to manage it. As the virus continues to circulate and evolve, we know what steps need to be taken to protect ourselves, our communities, and our healthcare system. The most important is to stay up to date with your vaccinations. I will again provide thanks to everyone for continuing to follow public health advice. Thank you, and I can take questions now.
Dr. Moore, could you tell us why you waited until this point in the 7th wave to open up the eligibility for boosters? Moreover, do you know how many vaccine doses were thrown away while pharmacists waited for this decision to be made?
So, as you've heard me over the last several weeks, we've been having a call to arms for those that are the most vulnerable, so the 5 million Ontarians that haven't had their first dose and the 1.6 million that haven't had their second dose. That's been our consistent and persistent message. We're now opening up eligibility to those that have between 18 and 59 years of age that have evidence to support them getting a second booster dose. So that primarily those who should consider getting that vaccine are those with underlying medical illness, because they'll get the greatest benefit. So if you haven't had your booster dose yet, you're between 18 and 59, and you smoke or have diabetes and or any underlying illness, please consider getting that booster dose. This is timely advice for the general public. We know it's the summer time and people want to move on past the pandemic, but it's a clear reality now that we have to deal with this BA.5 variant. We need all Ontarians to come forward to get vaccinated. As far as wasted dosage, we are meeting a standard of care consistent across Ontario and can have those numbers to you in the next couple of weeks.
Am I going to get the second booster dose in pharmacies anywhere different? And what about kids? Are they eligible for a booster, doctor?
So right now it's 18 to 59, and thanks for that question. All our pharmacy partners, public health units have been briefed, as well as those that provide vaccine in their primary care clinics are absolutely willing to provide the vaccine. Our capacity at present is roughly 100,000 Ontarians a day that we can vaccinate, and although we've had a significant increase in the last several weeks, we're up to roughly 16,000 people immunized yesterday. We have capacity to immunize anyone interested in maintaining the level of protection we need to combat this nasty, aggressive virus.